Manny Pacquiao to have shoulder surgery, miss extensive time. Manny Pacquiao will undergo surgery this week to correct a torn rotator cuff in his right shoulder, the fighter's advisor, Koncz, told USA Today Sports on Monday. ESPN, which was first to report the news, cited Los Angeles orthopedic surgeon Dr. Neal ElAttrache, who said Pacquiao has a significant tear and will be out 9 to 12 months. Pacquiao, 36, suffered the injury during sparring for the Floyd Mayweather fight, which he lost via unanimous decision Saturday in Las Vegas. Koncz said the injury occurred around the first week of April. Rematches. Presidency. What will Pacquiao do next? Manny should be commended for going through the fight, because I certainly wouldn't have done it if I was the boxer, Koncz said during a phone call. We're not making excuses. It's an injury that was exacerbated in the fight. And we're not taking anything away from Floyd. Manny did his best on Saturday. Floyd was better at that moment and won the fight. He deserves the win. The injury got worse. The MRI is the proof of that, Koncz added. The one taken today compared to the one that was taken in the first week of April, there's a dramatic difference in the problem. Koncz said the surgery will be performed at an undisclosed location and that there will be a formal release of procedure and prognosis from the doctor following the operation. Pacquiao after fight, I thought I won. The injury, Pacquiao and trainer Freddie Roach said Saturday, affected the fighter's ability to throw his patented right hook. Roach said he even considered postponing the bout after learning of the injury in early April. In a joint statement released earlier Monday, Pacquiao and Top Rank elaborated on the injury. Manny went to see world-class doctors, partners in the prestigious Curl and Job Orthopedic Clinic, who performed tests and, in consultation with Manny, his promoter, and his advisors, concluded that with short rest, treatments, and close monitoring, Manny could train and, on May 2, step into the ring against Floyd Mayweather. Manny continued to train and his shoulder improved, though not 100%. In consultation with his doctors, promoter, and advisors, Manny decided to proceed with the fight, anticipating that he could receive his pre-fight treatment. After consulting with doctors, Pacquiao's team decided on Toradol, a non-steroidal anti-inflammatory, as pre-fight treatment. Pacquiao's advisors then contacted the United States Anti-Doping Agency, USADA, the group responsible for overseeing agreed-upon random drug testing. After speaking with Pacquiao's doctors twice and investigating, USADA approved the proposed treatment for training and fight night in writing. However, USADA doesn't oversee the regulation of fights and is not a governing body. The group simply approved the treatment for the purposes of drug testing. FTW, Mayweather-Pacquiao was a complete waste. When the Nevada State Athletic Commission administered the pre-fight examination Friday afternoon, they gave Pacquiao a questionnaire. Question number 6 asked if he had any injuries to your shoulders, elbows, or hands that require examination, and the fighter checked no, the commission's executive director Bob Bennett told USA Today Sports on Monday. In fact, Bennett says the commission wasn't aware of any injury until Pacquiao's team asked for the Toradol injection, as well as lidocaine, a numbing agent, at approximately 6:08 p.m. Pacific Time on fight night. According to Bennett, Top Rank then alleged that USADA had provided documentation that informed the commission of the shoulder injury, but he says they never received such information. Bennett says he contacted USADA Sport Testing and Resources Director Andy Morrison to ask if any emails were sent regarding the injury, and Morrison said he hadn't. Rogers, fighters cash in, but fight was a loss for the sport. The commission then interviewed Pacquiao's physicians, who advised that his health and safety would not be at risk if he fought without the injection. Manny then assured the commission that his shoulder felt fine and strong, and it was not bothering him, and that he was ready to fight, per Bennett. Pacquiao was also interviewed by the commission's physicians at the Friday weigh-in, and informed them of no problems with his shoulders. According to the record, his strength appeared equal in both arms, and he had full range of motion in his shoulders. That information, in addition to his denial of a shoulder injury on the questionnaire, led the commission to disallow the injections. Could the commission have allowed Pacquiao to take the injection once they found out Saturday night and taken Pacquiao at his word without any MRI results? If we had information 4 weeks ago when Top Rank knew about Manny's shoulder injury and they brought that to our attention, then we obviously would have worked something out, Bennett said. But the drugs that Manny wanted to inject himself with were not PEDs. They're not on the WADA panel. What else did you expect? Mayweather wins doing what he does best. There's no TUE, therapeutic use exemption, required. So it's not an issue, in all fairness, the USADA. For whatever reason Top Rank, at that point in time, didn't think it behooved them to notify us of Manny's injury. Bennett says it wasn't purely an administrative oversight. If his shoulder was simply sore, and you gave him Toradol, it would of course increase his punching ability, he said. It may also create serious damage to his shoulder, if in fact his shoulder/rotator cuff is torn, or he has some type of shoulder injury. In light of the serious injury, there could be renewed interest for a rematch. However, that might not be possible due to Pacquiao's recovery timeline. Mayweather says his final fight will come in September, before he rides off into the sunset.